9:45. We'll go ahead and get started. I did receive a call from Woodlawn, and they had a situation come up during the award presentation that had to be addressed. So I'm certain that everyone can empathize with that. But they were very grateful for the award and wanted to extend their apologies for not being able to attend, but certainly an understandable situation. So David, I'll go ahead and turn the presentations over to you.
All right, so we're going to start off the second batch of awards the same way we did the first, by giving out another community impact award. We wanted to showcase both work directly related to the pandemic, like we did this morning with Cameron Memorial, but also other ways that our hospitals have helped their communities, as with our winner this afternoon. So while we all know that access to labor and delivery services is dwindling in rural communities, our winners today took it upon themselves to try and find a solution to still help their community after they had to make the difficult decision to stop offering it. Recognizing that their county had one of the highest infant mortality rates in the state, the hospital chose a strategy to restructure how obstetrical care is provided in a rural community. The team created Healthy Beginnings to provide care to local mothers and infants that focus on access to care, care coordination, and improved emergency care for pregnant women living in rural communities without OB labor delivery services. For this stellar work to find a solution in difficult circumstances, we would like to award the second Community Impact Award of the day to IU Health J.
And that team is welcome to unmute their lines and just say a few words.
Hi, everyone. This is Julie Teeter. If you can hear me, thank you. We're excited to accept this award and honored to be a part of the Healthy Beginnings program. We aim to improve the health of families in our community by increasing access to care, offering care coordination, and improving our rural ED's readiness for OB emergencies. So we are very thankful for this award. Thank you.
Thank you, Julie. All right, so moving on to the second one this afternoon, we're going to this time look again to a second award session is going to look at a single person who has stood out for their leadership over the past year. This individual serves in a variety of critical leadership roles at their hospital, most notably through their leadership of the hospital's quality services department. This includes work with infection prevention, nursing education, patient safety, emergency preparedness, accreditation, and patient experience. While all this is commendable in and of itself, their focus on and evaluation of COVID-19 as early as January 2020 proved instrumental in the hospital's preparation for the pandemic to come. This put their hospital and community ahead of the game and helped them to not experience a lot of the shortages that were seen throughout the country, as well as work with their community partners to do everything they could to help manage the pandemic. We would like to award this year's Outstanding Critical Access Hospital Leadership Award to Kara Moyer of Deaconess Gibson Hospital.
And if that team would like to unmute and go ahead and speak.
Well, hi, this is Claudia, and Kara, I hope you are so surprised because we have had to keep this as a big secret. You know, it's just an honor to get to work with somebody like Kara. Every team in healthcare, as well as everywhere else, needs to have a really strong leader who is also that utility person who can go into a variety of capacities that are needed at the time and excel. And Kara Moyer really is that person for us. You know, the pandemic work,
Looks like maybe Lois is frozen. Kara, would you like to unmute or? Carolyn, are there some issues with Zoom?
I'm not seeing any issues on our end here, Becky. Other folks' videos and audio are still working.
Okay, all right. Also,
It looks like Claudia may have dropped off, and it looks like Kara may have at the same time. I wonder if their hospital had some connectivity issues.
okay. Is Jonathan still on? Maybe we could try to unmute him again from IUJ.
Yes, he has the ability to unmute himself now.
Okay, Jonathan, maybe if you hover at the bottom of your screen, there's an unmute button there. Are you unable to unmute yourself now? This is the beauty of a virtual meeting. And I don't know, Allie, if you can manually unmute him.
I can only ask him to unmute, which we have done. We've given him the ability to speak, and I sent him an ask to unmute.
I mean, I don't know how it could have been considered either, but we're on there.
And there we've got Kara back now.
Hi. Sorry, I'm not.
To say a few words.
I just want to say thank you so much. I'm very overwhelmed. I'm very, very fortunate to work with the team that I work with at Deaconess Gibson that affords me the opportunity to do such amazing things in our community and for our hospital. So thank you guys again for this award.
Wonderful. You're very, very exciting. So it doesn't look like we're having any luck getting Jonathan unmuted. David, if you'd like to go ahead and move forward.
Sure thing. All right. So for our next award, we're going to be looking at another individual, one who has experienced the front lines of this past year. The pediatrician we'll be talking about today identified a need for expansion of children's vaccine programs in their county and set out to get their vaccination site for the pandemic to also be accredited for the Vaccine for Children program by the State Department of Health. Our winner has administered 855 vaccines for the VFC program since November of 2020, which does not include private vaccines or flu vaccines. Since implementation of the program in November of 2020, this individual has exceeded state standards for vaccination rates. Indiana's state vaccination rates increased by 5% in 2020. This county shows a 5.4% increase in vaccinations, exceeding Indiana's overall growth rate. For tireless work to support vaccination work, and particularly in the most vulnerable, we would like to award this year's Outstanding Rural Health Provider to Dr. Crystal Hahus. I hope that I said that right. I feel like I probably butchered it, but congratulations.
And if that team would like to go ahead.
This is Brian Herwig, the CEO at Perry County Hospital, and it's an honor and a pleasure to recognize Dr. Hahus and her staff for that work. She did start the Vaccine for Children program less than a year ago, at a time, of course, when we were in the pandemic, and our county health department, like all county health departments, was very busy fighting COVID and tracking COVID. So they started the Vaccine for Children program, and as was reported, the rate for vaccination is 4 times the county rate and twice the state rate. So we're really, really pleased. In addition, they did start providing COVID vaccines for their clinic several months back, and more recently, through a gift from our hospital auxiliary, have started the Reach to Read program, where all children that come into our clinics get a book on every visit, which helps not only the physical development, but the emotional development and the bonding with the children and stuff. So we're really pleased for Dr. Hahus and her team in Perry County, and the board and administration, all staff want to thank her. So great work.
Thank you. David, back to you.
All right. So for our last award of the day, wanted to take time to call out ways that our hospitals have found innovative answers to quality improvement at their locations. Our winners today identified a need to improve the patient experience in their emergency department and set out to find a way to do this. The hospital developed a program to improve customer and family experience that used a real-time feedback program to capture patients' experiences of their ED visits. This allowed the department director to follow up on any scores that they felt were too low. Using this data, providers can get immediate feedback on their individual scores and receive both positive and negative comments. The medical director also utilized this data to look for opportunities for improvement, provide immediate coaching as needed. This collaboration and partnership allows for an aligned focus and demonstrates that improving customer experience is important to the organization. For this tireless effort to improve the quality of patients' experiences in their ED department, we would like to give the Innovation and Quality Improvement Award to Decatur County.
Thank you. Oh, got feedback. Yeah, do you hear feedback over there, or is it just me?
We do. You need to shut off your speakers in your room.
Okay, we'll have Dr. Cardosi until we fix this. Won't we have you speak?
Ryan?
Oh, hey, this is Dr. Richard Cardosi. I'm the medical director of the emergency department at Decatur County Memorial Hospital. You know, we recently received a 5-star CMS rating at Decatur County Memorial Hospital, and this new innovation award reflects the overall quality that the hospital tries to maintain in every level that they can. This has been an effective tool for us because we get better data, we get more data, we get significant data because we get N values, we get responses that aren't just one-offs, we get significant numbers. And so the statistical validity of the numbers that I can give to the providers is high. Providers that I counsel with their satisfaction scores will basically disregard scores that have low N values. So if they have 3 responses, then it's not very valid. But the number of responses we can get from this new innovative program is such that we get trends, we get real significant data, and then we get direct comments about how we can be more effective, what went wrong in the patient experience. So we can give kudos to people who are doing well, and we can drill down on areas where we think we could have done a better job. And the goal, as always, is to improve. Patient experience of care is one that you cannot rest on your laurels. You continuously have to try to do well with every patient, every time, every encounter. And that's tough to do, but this tool has been helpful in helping us do that. I want to thank the administration because none of this stuff comes free, and it just shows their commitment to the quality that they have for our hospital. So thank you very much, and thanks for the award.
Suki, anything you would like to, you or other individuals in the room would like to say? Or try again? And now we can't hear you at all. I hate that.
Can you hear me now?
Yes, it's still echoing a little.
Well, I just want to thank Dr. Cardosi for his leadership. It wouldn't be possible without him leading the way.
Thank you. Sorry for the technical difficulties. So, David, I'll turn it back over to you.
All right, so that wraps up the awards for the day. This is always one of my favorite things to get to do each year because I don't feel like that we often get to recognize the hard work that goes into maintaining healthcare in a rural setting. So I always am very excited to get to do this. But I'm going to transition us to our next topic. So now we're going to look at, so I'll put it, so I say it all correctly, that in a different section, we're going to take a look at how to build a patient's plan of care that matters to them. And it's fun to get to do because I get to introduce some people here from the same department that I'm in, working with Wise Women. So I'm just going to run through the bios of these people real fast. So first off, we've got Brent Anderson, who you've seen a few times today. He's currently a practice coach for the Department of Health, facilitating primary care practice transformation and quality improvement work. He provides hand-on, on-site technical assistance to state-funded federally qualified health centers, community health centers, rural health centers, hospitals, and various other community partners across the state. We also have Trisha Runnington, who is the Wise Woman Program Director for the Indiana Department of Health. She received her bachelor's in kinesiology and a master's in public health at Indiana University. She also currently leading the effort to expand these types of services in Indiana by a new program, the Heart Healthy Hoosiers. Tries to practice what she preaches, getting outside and being active as often as possible, running, hiking, biking, backpacking, and kayaking with her husband and colleague. And then finally, we also have Julie Grease, who serves as the Early Detection Director for the Comprehensive Cancer Program. As a part of this role, she manages several initiatives, including the Indiana Breast and Cervical Cancer Program, which is a longstanding program that provides breast and cervical cancer screenings for women who are at or below 200% of poverty level through a network of providers. She also has a master's degree in health promotion from Purdue University and experience providing health education and health services at federal qualified healthcare centers, not-for-profits, and state government. In her spare time, she also enjoys time with her family, travel, yoga, and a really good book. So I'm going to go ahead and pass it off now, and we'll get this next section started.